St Elizabeth Hospice aims to improve the quality of life for patients and their families, offering an extensive range of essential services in palliative care, including an inpatient unit, hospice at home service, family support team and a full programme of daycare services. Anna Nicol is a new daycare patient at St Elizabeth Hospice, and the first step is for her to take part in an 8-week assessment programme to ensure the hospice services can be tailored to her needs.
Can I help?
Well, I hope so.
Each new patient is assessed at a one-stop clinic where they meet together with a doctor, nurse and family support worker, and a plan of care is agreed. This is based on the patient's needs and not their diagnosis, and includes elements relating to their physical, psychological, emotional and spiritual needs.
Right then, Anna, I'm going to show Roy a way to help you get out of the chair.
Anna and her husband Roy agreed that joining the Positive Living group would help them both. The group enables patients and their carers to explore ways of living with their illness in a positive way. For example, at one of the 6 weekly sessions, the physiotherapist will discuss ways of making moving about home more manageable.
A lot of the patients, when they first come to the hospice, believe that that's the end of the road for them, and they're very anxious. But once they get here, they soon discover that what we do, we work on rehabilitation, and we work with fatigue management and anxiety management.
When patients like Anna come to St Elizabeth Hospice, one of the aims is to support them at home for as long as possible, if that's their wish. Everything is about improving the quality of life for the patient and their families. This includes assessing and addressing needs such as pain control, symptom management and managing any anxieties patients or their families may have. It's about helping people live as normal a life as possible with an illness they will not recover from.
Right, I've just got to take your blood pressure now.
Okay. The programme of day services includes elements targeting patients' medical needs, as well as those tailored to emotional or spiritual needs. Whichever service is chosen, the care will be reviewed regularly to ensure the most effective support is being offered.
Yes, well, I would stay at home as long as I can, and if I had to come anywhere, that would be here. And I think I would be quite happy for that. The whole atmosphere of everything is so calm, they can't do enough for you, and that puts you at ease.
Patients are also offered the opportunity to join therapeutic sessions like this Creating Memories group. And there are events organised which involve the families and carers of the patients, so that they can once again enjoy everyday activities in a supportive environment.
All of the activities that we provide are tailor-made. They are there to actually address a need, so a problem or an issue that the patient or their carer is facing. And so in that way they provide a very specific function for each patient, which obviously we hope will have a positive benefit.
By offering daycare services for fixed periods of time, focusing on patients' and families' specific problems, the hospice is able to be flexible in its approach and meet the needs of more patients and families who need their care. By putting the patients at the heart of what they do, St Elizabeth Hospice ensures that each individual has an improved quality of life, regardless of their diagnosis and according to their need.